The MEI students are the future leaders of the community. They will be the individuals who will be working to bring about healthy communities. They will be the individuals who will work to make sure that there's a life in the community for everyone. The MEI program is very important. It is the foundation, I believe the foundation for developing a workforce that knows and understands all of the things that need to happen in a community to make a community healthy and whole.
Many of the government entities like SAMHSA, CSAP, and others see that there are certain critical aspects to effective programming and effective outcomes in programming. And HIV, in one aspect or another, they found that peer-to-peer is one of those key areas that will have an impact on the young folks, especially at the college level. And before, it used to be where we used to think that adults talking to youth was one way to say don't use drugs, or don't get involved in negative behavior, sexual negative behavior. But now they realize over time, and unfortunately or fortunately, we had to learn from others, that after a period of time, we now realize what really works in impacting young folks and how to really have them change their behaviors. And what we found is that peer-to-peer is one of those critical aspects to have an impact on young folks' individual lives, because young people talk well to young people.
This is now a part of our culture. It's not an adverse culture that's affecting our way of life. It's not affecting our tradition, but now the tradition is to save our young people. The tradition is to educate our young people on things that are harmful for them, whether it be sex or whether it be strapping on your seatbelt every day before you get up and you leave in your car. So I think that would be the biggest breakthrough, is that beginning to have the dialogue and beginning to start the conversation.
This conference has given me such a great impact that it's motivating me even more to go back to campus to let the students, the communities, the faculty, staff, everybody that is in my surroundings aware of how serious it is to make an impact on the awareness of HIV/AIDS.
Well, I'm a recovering individual, and I think it's important to say that. I'm 14 years removed, so I understand the struggle of substance abuse and how it can destroy one's life. I have been afforded the opportunity to change my life, and it's through these type of initiatives. Someone took the time out to help me recover. And I, in return, want to give back what was freely given to me. So I'm internally grateful anytime I have the opportunity to talk about substance abuse and to talk about HIV and AIDS, because I am one of those individuals who have lived through the process.
I learned a lot at the conference thus far, and a lot of the inspirational tools that were given to us today, as far as stepping out of the box, stepping out of the frame, and stepping into your leadership, and stepping into influencing others to be a part of what you're doing, just to encourage other people. I really have learned how to step outside of the comfort zone, because the things that we're teaching are sometimes out of the comfort zone for some people, and so you have to be able to step outside of that box in order to get to your demographic, to get to the people that you want to touch.
Being in the MEI program is going to help me in my future career options, because I actually plan on going into public health upon graduating. I'm a sociology major, and I want to continue in graduate school and get a degree in public health. So the training I received here is going to, prepare me for the career that I hope to obtain. So I'm getting all the training now, so I'll be ready for the future.
Okay, the training has been an experience to benefit me in the workforce and field that I'm going in tremendous ways. I can always take what I've learned not only on campus but also at the MEI training here and spread the word with many people. And if I only touch one person's life, then that's a great experience for not only me but for them as well, because they can take the information and spread the word, and it's just an ongoing thing. And before long, you would never know how many people you could change their lives and possibly save them.
And what we're doing now is we are grooming and presenting the next 40 years of African American researchers, scholars, and leaders. And that's what the MEI program is doing so well. They are providing, establishing, and supporting the next generation of African American researchers, and I can't thank them enough for it. So this is a good thing.
Funding for the MEI project was provided by CSAP. the Substance Abuse and Mental Health Services Administration's Center for Substance Abuse Prevention.